All right, we'll go ahead and get started. Thank you so much for being here. For the weekly COVID-19 media briefing, we have a special guest today, Mark Riddle, who's the Associate Dean. Dr. Mark Riddle is the Associate Dean of Clinical Research and a professor at UNR Med's Department of Internal Medicine and Medical Research, and a lead investigator of a recent study that came out regarding the COVID-19 vaccine. I'm going to post that press release in the chat. But we'll have Dr. Riddle start us off, and then we'll pitch it to Kevin Dick, the District Health Officer in Washoe County, and then open it up for a Q&A afterwards for both of those individuals. So Kevin, if you're ready, please go ahead. Sorry, I just completely misspoke. Dr. Riddle, if you're ready, please.
Sure. Thank you. And thank you so much for the opportunity to
mute, Dr. Riddle.
Can you hear me now? Can you hear me? No. Check one. Can you hear me?
Scott, I can hear him. Okay.
I can hear you perfect. Sorry, I was on mute myself. This is a disaster. Please go ahead and take the attention away from me.
Par for the course. So no, thank you for the opportunity to share this information with you. And I represent a team of collaborators with Immunize Nevada and the Nevada State Department of Health and Human Services, where about a month ago we launched a series of surveys to understand community and healthcare providers' attitudes and willingness towards receiving one of the authorized COVID vaccines once they become available. The overall goal of this survey, and it's an ongoing survey, so I want to make sure that we're continuing to collect information, is to help inform our communities about vaccine uptake, as well as, I think, spur important conversations about the vaccine safety, the importance of getting the vaccine, not only for our individual lives, but for our community. And so we are releasing a initial report here that covers about a month worth of data, the dates between November 25th and December 31st, where we have initial data for over 5,000 citizens in Nevada and around 1,000 healthcare providers from across the state. The top line results, again, these were the full report is going to be released early this afternoon. But the top line results are that we found about 65% of the public saying that they would likely get the vaccine once it becomes available to them. And while it's not exactly certain, public health experts suggest that herd protection or community immunity will require about 80 to 90% of the population to be vaccinated. So 65%, we have a good baseline, but we need to increase uptake and likelihood of uptake. As with the rest of the nation, factors that we found that were associated with decreased likelihood of getting the vaccine include race and ethnicity, and those particularly people who identify themselves as African American or Black or Hispanic are more hesitant to get the vaccine, as well as rural versus urban differences, where those who live in rural areas are more vaccine hesitant than in urban areas. important factors that people have when they say what's important in terms of making a decision related to the vaccine, safety and efficacy, which is really good news because the currently authorized vaccines are very safe and very effective. And so I think that that's an important, if that's what people want to see, I think we can do a good job of explaining that. Those that define themselves as healthcare workers, 77% are likely to get the vaccine. Again, this includes people self-identified, and so it included, physicians, nurses, pharmacists, PAs, social workers, dental hygienists, medical administrators, laboratory. I mean, it was a very broad swath, and so among all of those populations, 77% said they would likely get the vaccine, and 83% would recommend it to their patients. The highest rates of getting and recommending the vaccine are reported among physicians and pharmacists. And again, more detail will be put out in this first report. So those are the top line details. I mean, our goal is to hope that these data serve as a basis for important conversations in our communities, to learn more about the safety and efficacy and the importance of getting vaccinated to help us return our community and lives back to normal. We really appreciate the public's and the providers' willingness and time to take the survey, and we continue to ask people to take this survey as it's important to see how effective our conversations are and our education in our community are in improving the needed knowledge for us to make the best decision about whether we get vaccinated. And so those are the top line results, and happy to answer. Again, the full information is going to be available very shortly, but I'll stop there.
Okay, thank you for that, Dr. Riddle. Again, we'll have Kevin and Dick go next, and then we'll open it up for Q&A. Kevin, if you're ready.
Yes, thank you, Scott, and thank you, Dr. Riddle, for joining us today. And I had a chance to look at the report that you're going to be releasing later today, and thought it was quite fascinating and interesting, some of the results in there, and really appreciated the way that the data was presented to see not only the median response for our community, but also be able to see the distribution of the responses on those questions. So thanks for your work and making that available for our community. I'll start today with the COVID-19 vaccination update. And so to date, we've received 22,760 doses of the vaccine here in Washoe County. And the health district has given, or of those, the community partners that we work with have received 11,030 doses. Through yesterday, the health district administered 8,708 of those doses. So we are dispensing the vaccine as we receive it. We got our latest shipment of the vaccine on Monday morning. And in our pod yesterday, we were already beginning to dispense that vaccine because we had consumed all the other vaccine that we had on hand. So I want to emphasize to our community that while you may be hearing stories of delays in getting the vaccines provided in the news nationally and reports from the state of Nevada, we are working to ensure that the vaccine is dispensed as we receive it. We currently have 2,970 doses of vaccine on hand. I should say, as of this morning we'll be running a pod this afternoon. So we have 750 people scheduled. So we'll be dispensing that vaccine there on Friday. We also have a pod scheduled for Martin Luther King holiday. We'll be providing vaccine there, focusing on K through 12 education staff. They'll have the day off to be able to come in and get the vaccine. And it also works quite well with the timing on President's Day holiday for them, again, to have a day off to come back and get their second dose right on time. So the governor the other day, let's see, when was that? Monday night, provided the updated information and a new version of the vaccination playbook, and that prioritizes essential workforce. And so right now we're in that phase where we're working with K through 12 educators and childcare facilities. And from there, we'll be moving on to frontline staff at our higher education institutions. The playbook that the governor provided two lanes. One lane that we'll be working down is with the essential workforce. The other lane is the general population based on age and risk. And so the other lane begins with the 70 and older population. And because I think we're all well aware, we are here at the health district for sure, of the more severe impacts of the disease and the higher rate of mortality and morbidity occurring in the older population. So focusing on getting those vaccines out to the 70 and older population. We're grateful to Renown Health for opening up vaccinations to begin addressing this population. And they have also provided information to the community for those that have not previously received services from Renown Health and have a MyChart account. You are now able to register to get sign up to get a MyChart account to be able to get scheduled for vaccination if you're in that older age group. And but it's important for people to remain patient. I gave you the number of vaccines we've received to date since December 15th, 22,760 for all of Washoe County. We received at the health district about 3,000 doses this week. And while we're hearing in the news that there's lots more vaccine coming, currently we're fairly static over the past several weeks of the amount of vaccine that we're getting. So we do have still a limited supply. And when you look at the population that previously we had at just 75 and older before the governor dropped that threshold to age 70, just in the 75 and older population, we had close to 30,000 individuals in our community. So it will take a while to work through that population as we continue to also work to vaccinate our essential workers. And I'm very hopeful that the news we're hearing federally on the vaccine availability will come to fruition here soon with increase of our allocation so we can increase the vaccinations occurring in our community. As we get more vaccine, we also need to have additional vaccine administration available in the community. The state is working with pharmacies to have them available to administer vaccinations. We do have Walgreens and CVS that are currently working in skilled nursing and long-term care facilities to provide vaccinations for their staff and their residents. So those pharmacies are busy with that activity, but we have some additional pharmacies the state's working with that we anticipate will be able to begin providing vaccinations sometime around the 20th or after of January. And if other providers are interested in dispensing vaccine, I encourage them to contact us. They can email us at covidvaccine@washoecounty.us, and we can get them on the list to work with as more vaccine becomes available. But it's important to recognize we're not at the point now where we have vaccine to be able to distribute broadly through those providers. We want to build that network and have that plan in place so we can deploy that vaccine as it becomes available. This is a massive effort to provide vaccine to everybody in our community, not just once, but twice with the way this vaccine works. And so we're really asking for our community to help us in this effort. We will not be able to accomplish this just through the health district, but we need numbers of partners to be engaged over the long term in helping to dispense the vaccine. In addition to the vaccine effort, we're continuing with the other work that we've been doing on our testing. And it's important for people to understand that we still have testing available here through the health district, through our drive-through post operations. And currently the demand for testing has not been consuming all of the capacity that we have. So we are available if people are looking to get scheduled for testing for COVID-19. We are accepting everybody that is seeking to get tested, whether they're symptomatic or not. And we're also tracking the rate of the disease that's occurring in our community. And our 7-day moving average is about 242 new cases per day. So that's up slightly from late December, but not a lot. We were at about 220 in late December. So what I think we're seeing is sort of a flattening and a slight increase of a significant decline that we were seeing in the number of new cases that was occurring through December. We've had a lot of talk about, the surge that we could see from the holidays. I think what we're observing is a surge from the holidays that's blunting the decline that we were seeing through December. So rather than our new cases continuing to move down, they've come down and now flattened out for the last several weeks. So I think that's some of the impact that we're seeing. We'll continue to monitor. We're in a situation where we could still be seeing impacts from the New Year's Eve holiday. And so I'm hopeful that we will not see further increase from that, but that's a possibility. I'm hopeful that as we move past the impacts of the holidays, we see a continued decline in the number of new cases that are occurring, because I believe that the pause that the governor has instituted is having some effect in helping to reduce the spread of the disease here in Washoe County. And I'm hopeful we can get to continued decline. 240 new cases per day is still a very high number, and we need to continue to move past that for our community. We have also seen a reduction in the COVID confirmed cases that are hospitalized in our community, and so that's a welcome thing to see as well. Our hospitals still remain quite busy, but not quite as strained as they were previously. And so it's very important for everybody to continue to observe the precautions of wearing a mask, watching your distance, washing your hands, so that we can make sure that we're getting down to more manageable levels and having the healthcare system that we need to be able to provide care for everybody in our community. And with that, I'll turn it back over to you, Scott.
All right. Thank you, Kevin. We'll open it up to questions for both Dr. Riddle and Kevin Dick. Go ahead and fire away.
This is Paul Nelson with 2 News. How big of a first step is this for Renown to sign up and start with that second lane, vaccinating 75 and up?
I think it's a great step for our community, and it's just the kind of a partnership that we need. Our healthcare system, our pharmacies are responsible for providing the bulk of our vaccinations in our community historically, and so I think that's where we need to get is as vaccine becomes available. It's not just through the health district, but through all of those other providers that people are used to going to for the vaccine. And the fact that Renown has stood up and developed a pod facility at South Meadows, I think is perfect for this time of where we're at with our response and the vaccine rollout. We really want to be looking at opportunities to do large scale efforts for vaccination, and they've established infrastructure to do that.
Hi, this is Siobhan from the RGJ. You talked about it a little bit last week, how you want organizations such as the school district to kind of create their own pods at some point. Can you kind of what are the steps again they have to go through? And then also who can give the vaccine? Because I see they're recruiting like vets and vet techs and anybody who they can to help administer the vaccine.
So the school district is working kind of on a parallel path with the health district right now, led by our regional incident command, working with fire and the school district staff to set up pods at several of their high schools down here in the Truckee Meadows and with North Lake Tahoe Fire to be able to do vaccinations for the school staff up in Incline. So they're going down that path for some of those vaccination events, as well as using our pods. So kind of a dual path because of the number of staff that need to be vaccinated there. And the governor's directive, Directive 11, provided some flexibility for expanding scope of practice for different types of medical providers to be able to step up and provide the resources that we need to respond to this pandemic. And so as far as the vets and the vet techs, I can't give you the detail on exactly what role they're going to play with the school district. I know the Board of Dental Examiners yesterday had an emergency regulation for allowing dentists to administer the vaccine. I knew that there was an effort to have the veterinarians available to do that as well, but I'm not certain today exactly where that is at.
Now they'd have to go through like a fire department or something. Wasn't there something where you said they could hire or work with the doctor to create their own pod separate from you? Right now they're just doing this pod system with you though. Is that?
They're working in conjunction with the fire departments is my understanding for those to be administered under the physician identification number of the fire departments that are involved. But I'm not directly involved right now in that planning process. So I mentioned that's happening through the regional incident command working with the school district.
Mr. Dick, this is Madison with News 4. My question to you is, when will we start seeing seniors getting vaccinated in Lane 2? How do they sign up if they don't have a primary care physician? And what do you tell those people who have a hard time getting online given their age?
Well, as far as how they can get signed up right now, that would be through the signing up for My Chart through Renown. And I think that Scott Oxford can provide information on that process that Renown has put out if you don't have that already. And then as far as folks that are in that age group that aren't comfortable with getting signed up electronically, we're working to solve for that problem and develop a pathway for them to be able to get scheduled as well moving forward. And I think there was another piece to your question that I forgot.
Oh, I just asked, when will we start seeing people in Lane 2 in this age group get vaccinated through the health district?
So we're trying to work to maximize the vaccine that can be provided through our community partners to that age group, so that we can work with the essential workforce through the health district vaccinations. But we'll have to assess how that's working and create the appropriate balance to ensure that people have the opportunity that they need in order to get the vaccine. I think what we want to ensure is that we are making progress in both lanes
just do it as
to be able to get the essential workforce vaccinated, in addition to the working through the age ranges and the people with other underlying health conditions in the second lane.
Thank you.
It sounds like
Kevin.
Needs to mute their line too. If you're not speaking, please mute your line. Thank you.
Yes, Kevin, this is Laura with Reno Lia. We have a good number of undocumented people here in Nevada, and Washoe County is not the exception. Some of them, I'm assuming that they're not gonna go and get the vaccine because they're afraid that their information is gonna be disclosed to other parties. So I know the governor said yesterday that that is really confidential and only the medical personnel has, have the information. But can you elaborate a little bit about that?
Sure. Thanks. That's a great question. And the information about that people are vaccinated, those are private medical records, and they are not shared with the federal authorities. The health district has provided services to the undocumented immigrant community for many years, and have done so in a confidential manner. And I think we have a very good track record with that. So that information is protected, and if people are undocumented immigrants, I urge them to get the vaccine when they have the opportunity to, when it comes to their turn as we move through these workforce classifications or their age groups, because it's so important for both protecting their health, but also protecting our community as far as the spread that could occur if people are not vaccinated.
Okay, thank you.
Hey, this is Lucia Starbuck with KUNR. Can you talk again about what Washoe County or the health district needs to do to ramp up once we start getting to the general population? I know you talked a little bit about you have some of the local fire departments on our side, but I guess what else do we need at this point to be at a comfortable level?
Well, we need to have our hospital healthcare systems involved as well in dispensing the vaccines. We'll need to have our pharmacies engaged in dispensing the vaccine. So just as many of us go to a pharmacy to get our flu shot every year, we need to have that same service provided through the pharmacies to be able to get the COVID-19 vaccine. And then we'll be also looking at opportunities to work with partners to set up other pod locations to provide additional opportunities for people to be able to show up and try to dispense a large number of vaccines at a time through those pods, the points of dispensing that we would set up.
And as a follow-up, how difficult is it to get those means set up, and is there an expected timeline?
Well, right now, a lot of the timeline is just dependent upon the amount of vaccine that we receive. And so in the early days here, and with very, very limited information from the federal government, it's hard to know more than a few days or at most a week in advance what's going to be occurring. So that's a real barrier that we face, that the governor addressed during his remarks, is we have no line of sight beyond a few days in front of us sometimes as to how much vaccine we're going to get. We only know on Friday how much vaccine we're going to get the next Monday to take us through the next week. And the government has provided us with no information on what will be available the next week or the next month, et cetera. So we really need that transparency from the federal government if we're going to be successful in ramping up and rolling this out. And so I'm frustrated that right now we're just continuing to hear that there's all of this vaccine that's going to be available, and yet they're not telling us when and how much. We really need that information.
Thank you.
Middle and high schools go back on Tuesday. How are you feeling about everything and the system with the additional contact tracing?
Well, I think that we've been working with the county to support that effort. But I would refer you over to the county communications, Nancy Leuenhagen. They've been taking the lead in bringing on that county staff for that contact tracing initiative.
Any other questions for Kevin Dick? And we have Dr. Riddle on as well. Okay, well, thank you, Dr. Riddle, for being on, and thank you, Kevin. We will post the recording of this on our website, covid19washoe.com/press conferences. If you want to go ahead and you can see all of the previous ones we've done as well. If you have any further questions, reach out to me. Otherwise, have a great week. Thank you very much.
And if I could, please take a look at Dr. Riddle's report. I think you'll be quite interested in it, and it's good information for our community. So thanks, Dr. Riddle.